This video will talk about different types of therapy and when it may be important to seek therapy. Therapy is a form of mental health treatment, and generally speaking, it's important to get mental health treatment when someone, due to some emotional or psychological distress, notices that their work is impaired, maybe their school is impaired, maybe they're struggling in their relationships or something in the community. That can be a sign it's important to get mental health treatment. But in order to benefit from mental health treatment, it's also important that one is making sure that alcohol, drugs, medications, medical problems, those sort of things are not contributing to what's going on, because that can make it more difficult to get benefit from the treatment. In the event as someone is seeking therapy, there can be several different approaches, and typically clinicians will choose a variety of approaches with what the person is going through. Many times a therapy can be an uncomfortable process and actually increase anxiety or tension, but the thought is increasing that tension or anxiety in the therapy session will help someone to better deal with it outside of the therapy session and within the community. So the first type of therapy that I'd like to address is cognitive therapy. And just as it suggests, cognitive therapy involves changing one's thoughts, and it's thought by changing one's thoughts that'll change their feelings and that'll change their behaviors. And so it's kind of a cycle where they all interact. It's also under the premise that oftentimes people's mental health distress comes because of the way they're thinking or viewing the situation. And so by changing that, that will help change the distress. I have several videos that I've talked about common ways and misconceptions people may think about, or common cognitive distortions that need to be addressed. I also have videos about a CBT worksheet that someone can try either alone or in a therapy session with a therapist. So be sure to look at those videos for more information about cognitive therapy. Cognitive therapy is often one of the preferred ways to deal with anxiety disorder, mood disorders, or working through traumatic events. So cognitive behavioral therapy is this notion that changing the thoughts will change the behaviors. That can be considered a subcomponent of behavioral therapy. Behavioral therapy deals with the psychological concepts such as classical conditioning and operant conditioning. In classical conditioning, a research scientist by the name of Ivan Pavlov, who noticed that in his dog's behavior would change based on the signals in the environment that were learned over time. And so this sort of principles have found to be true in humans as well. It's an important principle to keep in mind with behaviors that one have learned over time that are incorrect, and this can happen with sleep or obsessive compulsive disorder, and I'll have more information about how it affects those conditions in a sleep hygiene video that you can click on the link above here, or an obsessive compulsive disorder, which will be coming out soon. Another form of behavioral therapy is operant conditioning, which is essentially rewarding good behaviors and punishing bad behaviors. And so as you can see, behavioral therapy may be beneficial in children or adolescents, or people who are intellectually limited or need some sort of parental or authoritative figure in their life. Emotional therapy simply examines one's emotions and tries to work through them. Whether it's sadness, anger, frustration, the therapist will work with the patient to focus on these emotions and how to handle it in a safe setting. If these emotions are directed at a particular person or individual, there's a technique called the sitting chair technique, or the seated chair technique, where the patient will pretend that whoever they're having the emotions to is sitting next to them, and they will play out how they would react to them. And so you can imagine this can lead to a variety of unique circumstances that the therapist observes and may comment on, and to bring insight and understanding for the patient. Next is dialectical behavioral therapy, and this is most commonly used for people diagnosed with borderline personality disorder. But dialectical behavioral therapy has other techniques that may be useful in personality disorders, addictions, or other mental health conditions. I have a full video about dialectical behavioral therapy that walks you through step by step how to go through it, so you could refer to that video for more information. Psychodynamic therapy is one of the unique therapies that deals with psychoanalytic theories that were developed by the earliest psychoanalysts, such as Sigmund Freud, Carl Jung, Erik Erikson. It really involves establishing a framework, like a regular visits every time each week or every few weeks in the same place, same time, same environment, same scenario, to try and really observe the patient's patterns over time. It's important for the patient to be comfortable to share all their thoughts and feelings to the therapist, even if it's about the therapist in general. And it's by analyzing some of these thoughts and emotions and behavioral patterns that the patients go through that one can sort of gauge an understanding of how the patients are interacting with people in their life. For example, if the therapist is seen as a parental figure or a supervisor, then that could be a good sign that the patient in their life is interacting similarly to their parent or their supervisor. This type of therapy often deals with these notions such as transference and countertransference, which is basically taking into account the patient's emotions towards the therapist and the therapist's emotions towards the patients. And so for therapists, they also have to be careful that they're not having a bad day or that they're not going through some personal issue that they're projecting onto the patient themselves, because that can also play a role in the treatment. Oftentimes, a therapist acts like this container of where they just allow the patients to project their emotions, their thoughts, their feelings onto the therapist, and the therapist has to sort of analyze it and deal with it, and also try to use that to gauge what the patient may be going through and share that information with the patient. Next is interpersonal therapy, and as the name suggests, it has to do with people's relationships with others, whether it's a spouse, a parent, a supervisor, and it really takes a look at the relationship patterns over time, what's worked, what hasn't worked, if the person involved in their life, if they're not involved, expectations, etc. Next, there's trauma-focused therapy, and this, as the name suggests, deals with people who have been a victim of physical, emotional, or sexual abuse in their life. And there's many different types nowadays of trauma therapy, such as brain spotting, EMDR, but similar principles are that the therapist's office will be a safe place to express the anxiety, fear, anger that may be caused by the trauma that's happened. And the therapist helps guide the patient to thinking about this in a calm way, and by trying to see the good that's happened from it, the good that is in their life, that'll help to expedite the healing process and the injury that's occurred in the patient's life. Next is mindfulness-based therapy, and in short, this is just being aware of all one's thoughts and feelings that are happening at any given moment in time, and not spending too much energy or really dwelling on it or rationalizing about it. I have a full video that talks about mindfulness-based therapy and can walk through it in more details, but it has shown to be very effective in mood disorders, anxiety disorders, even certain medical conditions such as pain, arthritis. Next is logos therapy, and this is a unique form of therapy that was first coined by Dr. Viktor Frankl, who is a Jewish psychiatrist that lived in the concentration camps during Nazi Germany. And so this type of therapy helps somebody to find the meaning in life, and it's by finding that deeper meaning and purpose in life that'll help them get through the difficult times and persevere through the difficult times. And let me tell you a secret, that's through Jesus Christ, I'm pretty sure. But don't take my word for it, find out for yourself. Next is family therapy, and family therapy takes a look at the family dynamics that are happening between the parents and the spouses and the kids. And this can be particularly important if there's a family member that suffers from bipolar disorder, schizophrenia, or an addiction. You want to just make sure that the home environment is conducive to provide mental health healing and treatment, because sometimes family members can enable bad behaviors or be on different parenting styles or be very emotional, which sort of just aggravates the situation. Next is couples counseling, and this can be particularly helpful for couples that are in a marriage relationship or couples that are looking into a marriage relationship. So those in a marriage relationship will oftentimes, a therapist will help them find common goals that the two can work on together to help with their relationship. Sometimes, but not all the times, one of the members, if not both of the members of the couple, need to get their own therapy and psychotherapy treatment. But it's important to do this with a therapist that's not their couple's therapist. Otherwise, there may be a hidden bias and lead to some jealousy or resentment between the couple. Another type of counseling is premarital counseling. I see this oftentimes in people who are the Christian faith, and they want to just prepare for some of the demands and challenges that might happen during a marriage, such as financial, taking care of children, work environment, what their life is going to be like together as a shared unit. The last type of therapy I want to talk about is group therapy. And group therapy involves like a collection of people, anywhere maybe between 4, 6, 8, 10, 12, a collection of people that talk about a common issue or problem, whether it's personality, whether they talk about depression, whether they talk about a specific therapy approach like DBT or dialectical behavioral therapy. Sometimes there's a therapist or psychologist that leads the session, but not all the times. But this can be a unique form of therapy because not only can you see one's interactions with the therapist, but also amongst other people as well. So you're gonna bring a unique sort of insight into one's dynamics with other people in a group setting. I hope you liked this video and benefited from this. Be sure to like the video if you liked it and subscribe to the channel for more videos.